Have you been told that you have sciatica, but you don't really know what it means? Today, we're going to break down what sciatica really means, including what it is, why it's happening, and what you can do to start feeling better today. Many people have pain that is going down their legs, and they believe or they've been told that it's sciatica type pain. And what you may be suffering with may be sciatica type pain, but if it's not and you're watching a bunch of videos on sciatica, they're not going to actually be helpful for you. So let's start there. What is sciatica? Sciatica is actually an irritation of the sciatic nerve. The sciatic nerve starts in your low back. It runs through your glutes, down the back of your thigh, and at the outside of your knee, it splits into two branches, one that goes down through the back of your calf and one that goes down through the side of your leg, both of them going into your feet. Common symptoms are burning or sharp shooting pain that runs down that pattern. But it may also include numbness, tingling, or weakness along that same pattern of the nerve. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I have a PhD in orthopedic manual physical therapy and strongly believe that movement is life, and you deserve both. So now that you know what sciatica is, you probably want to know what caused my sciatica to start in the first place. So there are three common causes of sciatica, and we're going to talk through each one of them while we're looking at the skeleton here. The first one is a herniated or prolapsed or ruptured disc. There's all kinds of different names for this. However, it's an irritation of the disc that's in between the vertebrae. I'm going to turn the skeleton around to show you here. It's a little bit easier to see this from the front when we're talking about the discs. So these are the vertebrae. Those are the bones that make up the vertebral column. In between, you can see these things. These are the fibrocartilaginous discs, and they help with things like shock absorption, as well as allowing our spine to have the flexibility that it has. Now, you may be able to see these little nerves coming out on the side here. I'll turn them to the side so you can see it a little bit better. So you can see this little nerve coming out the side. That's the nerve root. And for the sciatic nerve, several of these nerve roots come together to actually form the sciatic nerve, which means if any of the discs are herniated or ruptured or injured, as demonstrated here by this red part, you can see how that would impact the nerve root directly. So when that disc is damaged, it can put pressure or compression on that nerve root, thereby affecting everything that that nerve root touches, including the sciatic nerve, which is going to come together from these nerve roots and go down the back of the leg. This is especially common in younger people who are more active and tend to do more things like bending and twisting and higher level activities that can cause damage to the disc. The next most common cause of sciatica is spinal stenosis. We tend to see this in the older population because it's actually when arthritis has formed within the spine. Now, this may be arthritis that's formed here, where the nerve root is coming out, or deeper in here, where you actually have the spinal cord. Most commonly, if you get a spinal stenosis diagnosis, they're actually talking about spinal stenosis that is inside where the spinal cord is. So if you have this bony formation on the inside, it's going to put pressure on any nerves that are traveling through there. And when we get down into the lumbar spine or the sacrum, where the nerve roots are coming out, that's where we have all these nerve roots coming down. Now, people with spinal stenosis tend to have more symptoms when they're standing up straight and decreased symptoms if they're bending forward. So if you find yourself going to the grocery store and grabbing a cart right away because it's much easier to walk when you're bent over forward on it, it may be spinal stenosis that is causing your sciatica. And the last most common cause of sciatica is piriformis syndrome. So the piriformis is a muscle that's actually deep to the glutes. If you've ever tried to rub out a knot that's really deep in your glutes, most likely it's your piriformis muscle. It originates on this side and goes into the femur or the thigh bone over here. Now, this piriformis muscle is supposed to be an active mover. However, it is one that will become a postural muscle if there's any kind of a difficulty within the hip. And the reason why that's a problem is when a muscle is supposed to be an active mover, it really wants that contraction and relaxation to help get blood flow to it. So when it becomes more of a postural muscle, then it tends to become tighter and lose some ability to be able to contract and relax, which means it doesn't get the blood flow it needs. Now, why the piriformis muscle commonly leads to sciatica is because the piriformis muscle comes from these nerve roots and travels down either through, underneath, or on top of the piriformis muscle. We all have genetic anomalies, so yours may be different. We all have genetic anomalies on where the sciatic nerve runs, but roughly a third of people, it's either through, underneath, or on top of the piriformis. Now, if that piriformis is acting as a stabilizer and not contracting and relaxing well, it is going to get tight. And when it becomes tight, it can put pressure on that sciatic nerve that's traveling through it or underneath it. That's why the piriformis muscle in particular is one that causes sciatica often. Many people who suffer with piriformis syndrome causing their sciatica will actually feel better during the day as they're moving more and getting the piriformis moving and getting more of that blood flow, because then you have decreased inflammation around the sciatic nerve. But it really gets irritated when they're in a prolonged position. So something like sitting for a long period of time or standing for a long period of time, and definitely laying down at night. So hopefully you've been able to identify what the root cause of your sciatica symptoms are. However, what can you do about it? The first thing I'm going to ask you to do is put ice on the area that is the cause of your sciatica pain for 5 minutes, preferably every hour if you're having a lot of pain. Now, some people are like, I feel like it's coming from the disc, but I have pain all the way down my leg. Can I also put the ice down my leg? Absolutely. Start at your low back if you think it's coming from your disc, your hip if you think it's coming from your piriformis, and then work your way down the leg anywhere that you have pain for 5 minutes at a time. Please make sure you do this before bed to decrease your symptoms as much as possible before you lay down. The next thing I want you to do is gentle, pain-free range of motion exercises. We do want to keep moving to reduce the risk of inflammation building up. However, we have to stay in that pain-free range of motion. The reason why is because when we have pain, the muscles automatically tighten up. And what helps to decrease that inflammation is the muscles pumping. So you have the muscles contracting and relaxing. That's what they're supposed to do normally. However, when there's pain, they just tighten up. So we have to stay in that pain-free range of motion to help decrease the inflammation that's irritating that sciatic nerve. This is definitely not a situation of no pain, no gain. A simple exercise that you can do while you're sitting is making sure that you're sitting up in a good position so your head is over your shoulders and your shoulders are over your hips, and then turning gently side to side. This is just a pure rotation motion, and you're only going to go as far as you can pain-free. Now, for some of you, if you have a lot of sciatica symptoms and they're really sharp and shooty, your range of motion may be very, very limited, but that's okay. You're still helping to improve the quality of the disc through rotation while not causing the muscles to tighten up because of pain. And friends, please, whatever you do, stop stretching your hamstrings and stop stretching your sciatic nerve. I have seen numerous people in the clinic who were told either online or by another therapist that they needed to stretch their pain out. And there is one thing that I can guarantee you is true. The sciatic nerve does not like being stretched. And as we talked about in the beginning, the sciatic nerve runs right along the path of the hamstrings. So if you're stretching your hamstrings, you're also stretching your sciatic nerve. Now, if you have no sciatic nerve pain, you can stretch your hamstrings and it's not a problem. However, if you're having sciatic nerve pain and you stretch your sciatic nerve, it's going to increase your symptoms substantially. And I understand that this is super controversial because this is different than what everybody else says on YouTube. But please, I ask you, just try it. Try it for a week, stop stretching it for a week, and see if your symptoms decrease. The nerve needs space and calm, not more tension. And it is really important that you understand the root cause of your sciatica. So we discussed the 3 main causes above. So I'd love for you to drop a comment below and let us know which one you are. And if you feel like none of those really resonate with you or with your sciatica pain, then I'm going to recommend that you seek help from a medical professional, because you do want to know what the root cause of your sciatica symptoms are so that you know how to address it appropriately. And it is really important to make sure that you are sleeping in the correct position with sciatica so that you're not flaring up your symptoms at night, which means you need to avoid stomach sleeping, and you need to be sleeping either on your back with a pillow underneath your knees to decrease sciatic nerve tension, or on your side with a pillow between your knees to decrease sciatic nerve tension. We'll link a video at the end of this video if you have any questions regarding the best sleeping position for sciatica. It's important to understand that sciatica is a symptom. It is not actually a diagnosis. I understand your doctor probably gave you a diagnosis of sciatica. However, it's a symptom because what's happening is the sciatic nerve is irritated, but you don't know yet why. And hopefully now you know why that nerve is getting irritated. The cause determines the treatment. Please don't wait for it to get worse. Small changes starting now can make a big difference over time, but I do need you to be consistent with those. You should see a little bit of improvement each day, but it may take 2 or 3 weeks to really see a huge improvement, especially if your sciatica is really hot and flared up. Don't forget to drop a comment below with what you believe to be your cause of sciatica. If this video was helpful for you, please give it a like. And don't forget to subscribe for more science-backed, researched YouTube videos. If you're interested in talking with us in person, feel free to reach out to concierge at pt4eb.com to learn more about our online health coaching. And don't forget to check out the best sleeping positions video right over here.